The rotator cuff muscles of the pectoral girdle or the shoulder complex are a great lesson in line of pull. All right, so we have our scapula and our glenoid fossa and our humeral head. So here's our humerus. And based on where they sit around this glenohumeral joint dictates what the function is. All right, so first you need to orient yourself to what view you're looking at. Here's the anterior view. So on the anterior to the glenohumeral joint, you have your subscapularis. So that would be a medial rotator, right? It would grab the humerus and rotate it medially or internally. You have the supraspinatus, which you can see on both the anterior view and over here on the posterior view. It is above or superior to the glenohumeral joint, so that will be an abductor. And then you have two muscles on the posterior side or posterior to the glenohumeral joint. One is the infraspinatus, below the spinous process, and teres minor, right? And both of those are going to be lateral rotators or external rotators. Basically, the function of all of these is just to hold on for dear life to make sure that this humerus does not leave this glenoid fossa. So here's another view of it. You can see your supraspinatus above, subscapularis anterior, right? Because here's, we're looking at a posterior view. You have your infraspinatus pulling into lateral or external rotation along with your teres minor. Just note your teres major is just as small of a muscle as your teres minor, and it comes off the posterior side and dives under the axilla to the anterior of the joint, and so the teres major becomes an internal rotator, and it is basically called the little lats because it shares all functions of the latissimus dorsi.